Honorable Deputy Governor Franz Manderson, Honorable Minister for Health and Wellness Sabrina Turner, esteemed speakers and presenters, members of the Health Services Authority Board, members of the Healthcare Conference Organizing Committee, ladies and gentlemen, good evening. Thank you for joining us for the 15th Annual Cayman Islands Healthcare Conference. My name is Ben Mead, and while my day job is Senior Manager of Communications at DART, I'm here tonight as your moderator, and I thank the organizing committee once again for entrusting me with this duty this evening and for the next 2 days of the conference. Now, this is 4 years running that I'm standing at this podium, so I'm either doing something right or being punished to do it once again. We do have a packed agenda to get through during the conference with a lot of information around this year's theme, the healthcare ecosystem, public, private, local, global. Before we get started, one housekeeping matter. For those of you in the room, please ensure that your mobile phones are on silent or vibrate so we have as little disruption as possible. And I will ask that if you do need to leave the room, we do ask that you do it maybe when I'm speaking, not when one of the presenters are speaking. That will ensure everybody is able to hear the presentations as they are being made. I would now like to invite the Honorable Deputy Governor Franz Manderson to deliver welcome remarks. Mr. Manderson has faithfully served the people of the Cayman Islands since he joined the civil service in 1981. He was the Chief Immigration Officer, the Chief Officer in the Portfolio of Internal and External Affairs, and was then appointed as Deputy Governor and Head of the Civil Service in 2012. He has been our Deputy Governor ever since, and we are honored that he's able to join us this evening for the opening night of this conference. Ladies and gentlemen, help me in welcoming Deputy Governor.
Good evening, everyone. Protocol has been established. I do want to recognize all of the amazing civil servants that are in the room. I have to look out for my team. I also want to give apologies on behalf of Her Excellency the Governor, Ms. Jean Owen, who unfortunately is not here, but I think she's going to come over the next couple of days. It is my pleasure to officially welcome each of you to the 2024 Cayman Islands Healthcare Conference. I have had the opportunity to attend this conference over the many years, and I've always been so impressed by the wide range of relevant, timely topics that are discussed. I expect this year will be no different. Equally remarkable is the roster of distinguished local and international speakers who are leaders and in some instances, pioneers in their respective fields, which adds further credibility to the conference and increased importance to the issues. I understand this year marks the 15th edition of the Healthcare Conference. I would like to congratulate the Ministry of Health and Wellness, the Health Services Authority, the Organizing Committee, and all other key stakeholders on achieving this milestone. Yes. I would also like to give special thanks to Minister Turner, who has continued to support this conference during her time as minister. Minister Turner, thank you very much. Your commitment to the health of this country is both commendable and appreciated. American essayist Ralph Waldo Emerson said, "The first wealth is health." The first wealth is health. I have found this to be true in my own life, and I'm sure all of you in this room will agree. Events such as this one helps to reinforce the messages that doctors, nurses, medical researchers, educators, insurers, pharmacists, and other healthcare support workers preach to us all the time, mainly that the best gift we can give ourselves is that of good health. It is a precious commodity that we often take for granted until there's the possibility that it can be taken away. Then it becomes a costly endeavor to restore. This year's theme, the healthcare ecosystem, local, global, public, private, is an exciting focus and at first glance seems to be broad in scope. However, when we really think about how various entities come together to care for us as patients and facilitate our health and our healing and recovery, you realize how interconnected and interdependent this complex network truly is. From the hospitals, private clinics, insurance companies, medical and drug suppliers, healthcare professionals, to the patients, nurses, pharmacists, administrative personnel, nonprofit organizations and charities, and yes, IT specialists, all work in tandem to deliver quality healthcare services. And as the theme suggests, those collaborations are sometimes local, global, public, and/or private. However, in the end, it's all personal to us, isn't it? It's our health, it's the care we receive, it's the overall experience. Therefore, it is important. I hope the next 3 days will be both informative and relevant. I encourage you to use the personal knowledge gained to gain new perspectives on managing your health, as well as better understand the synergies that must exist to move us from diagnosis to treatment, to follow-up, to prognosis, to healing, to recovery, and everything in between. Allow me to go off script just for a minute. 2.5 years ago, I was at the gym, exercising. I was on the treadmill, and I felt a pain in my chest. Earlier that year, I was at this conference, and I heard it said here, do not ignore the signs of your body. Listen to your body. Especially men who think that we are superheroes and nothing can happen to us. Well, that pain in my chest turned out to be a heart attack. But because I was here, and because of the information shared here, I did not ignore it. I got to the hospital, and I'm here. Yes. So that if there was any doubt about the importance of this conference, I think me being here is testament. So I want you to enjoy and be well. Thank you.